Well, a warm welcome to today's talk, Tuesday the 31st of August. Now, over the past few days, there's been quite a major paradigm shift, really, in the way experts are talking about this virus. Now, what it seems is now inevitable that everyone is going to catch this virus, whether you're in the UK, the United States, wherever you are. It seems inevitable everyone is going to catch it because of this more transmissible Delta variant, and the fact that people that are already vaccinated can still transmit the infection. So everyone is going to get it. So what experts are saying is, given that everyone's going to get it, what is the point of carrying on mass testing? Better perhaps to do testing on clinical grounds. Now, this is a major change. But what it means is I'm going to get this virus, you're going to get this virus, almost certainly, if this current wave of expert opinion is accurate, and it does make a lot of sense to me. Now, given that you're going to be exposed to this virus, would you like to reduce your chances of severe illness, hospitalisations and death? Well, of course. Therefore, if you've had 2 vaccines, the chances of that are going to be greatly reduced. And that hasn't changed. But the idea that everyone is now going to get this, we are not going to reach herd immunity. This has basically been accepted in the past few days, and it's a major change in thinking. We are not going to reach herd immunity. Initially, we thought herd immunity would probably be about 70%, then with a more infectious Alpha variant, maybe 80%, with a more infectious Delta variant, maybe 90%. But now that we're getting so many breakthrough infections, with very few breakthrough severe illnesses, hospitalisations and deaths after vaccine, but breakthrough infections, and those infected people who have been vaccinated are infectious, they can spread it on with the same kind of viral load as people that weren't vaccinated in the first place. All these ideas have come together, and the thinking has well and truly changed. So let's look at some evidence for this. So this is Professor Andrew Pollard, who of course was one of the lead, in fact he was the lead researcher in the Oxford vaccine development team. Clear that Delta variant can infect people already vaccinated. Yes, it can infect them, much less likely to make them sick, so it's very important to get vaccinated. And he thinks this is making herd immunity impossible to reach, even with high vaccine uptake, because of the breakthrough infections, and I must say I agree with that. Anyone who is still unvaccinated will at some point meet the virus. Now, just let the import of what he's saying there sink in. Anyone who's not vaccinated is going to get infected, and if they're not vaccinated, they've got quite a good chance of getting sick, hospitalised, or even dying, depending on their age and comorbidities. So especially people with comorbidities, and especially older people, vaccination is going to be more, it always has been essential, but it's now completely essential, because you are going to get this virus, you are going to be exposed to it. Anyone who is still unvaccinated at some point will get this infection, this virus. We don't have anything that will stop the transmission at the moment. Unfortunately, he is completely correct. So I think we're in a situation where herd immunity is not a possibility. Pretty strong words, really, for a scientist. Not a possibility. And I suspect the virus will throw up new variants that's even better at infecting vaccinated individuals. So I must say I'm a bit disappointed to hear him say that. I was hoping that this virus had become pretty well as transmissible as it can be, because it's got a limited number of mutations possible. But Professor Pollard thinks that there could be even more infectious variants on the way. Hopefully not more pathogenic, but he thinks potentially more infectious. So everyone is going to be exposed to this virus. Get ready for it with your vaccination status, and I would add with your vitamin D levels and general level of optimising health as well. So basically the idea now is, well, what is the point of testing? The virus is going to be everywhere. What is the point in testing? Better to test people who are sick. And this is what we do with influenza, to be fair. I mean, if people aren't sick with influenza, we don't go around testing for it. We don't go around creating statistics on how many people get influenza. What we do is when they come into A&E departments, then we'll test them for influenza and see if they've got it. We do it on clinical grounds. So the idea is to do this testing on clinical grounds as well. And if that means we don't get neat statistics, then so be it, because it doesn't matter. It's people getting sick that matters. In that vein, Angela Merkel has announced that end of free testing in Germany from October the 11th. So again, this is the sort of philosophy behind this change in policy in Germany. They're not going to be doing the mass testing. That means these graphs we've been looking at for the past 18 months now, where we look at the number of cases, are going to become irrelevant because we're not going to know the number of cases, the number of actual people infections, testing the number of people with infections testing positive on tests. We're simply not going to know that. We could estimate it, but we're not going to test mass numbers of people as we were before. Now, the vaccines, important to stress, the vaccines are working. So UK vaccination prevented 60,000 deaths and 67,000 hospitalisations so far, Department of Health figures. That was released a few days ago from the Department of Health. But it's never going to be enough to stop the disease from spreading. This is going to be endemic. It's almost endemic now. We are all going to be exposed to it. That makes a winter wave of infections pretty well inevitable because, of course, people that are already vaccinated can still get the infection this winter, just they're unlikely to get sick. Professor Paul Hunter, who we've talked to on this channel, East Anglia University medical epidemiologist, the concept of herd immunity is now unachievable. Again, strong words for a scientist. Unachievable. It's not going to happen. The virus is going to carry on spreading and everyone is going to be exposed. Because we know the infection will spread in unvaccinated populations, yes. And this is also disappointing from Paul Hunter. The latest data is suggesting that 2 doses is probably only 50% protective against infection and spreading the infection on. We still believe 90% plus effective at preventing hospitalisations, severe disease and death, in fact around about 96% or more. So that is still good, but I would have said that it wasn't quite as bad as this, but this is the latest from Paul Hunter, and this is what he studies all day, every day, all day. So there we go. Even people that are vaccinated still only going to be protected 50% after 2 doses of vaccine. Time to change the way data is collected and recorded as the virus becomes endemic. Why do we need to know the numbers? It's going to be absolutely everywhere for basically the foreseeable future, for the next few seasons, unfortunately. So Paul Hunter again, we need to start moving away from just reporting infections or just reporting positive cases. So move on to reporting people who are getting sick and hospitalised, or just reporting positive cases admitted to hospital. So yes, it's important to know the positive cases, but why do we need to know those that aren't sick? It's the ones admitted to hospital and those that are getting sick that we need to know about. To actually start reporting the number of people who are ill because of COVID, not the number of people who are simply testing positive, and most of those are very minor because of vaccination. Otherwise, we're going to be frightening ourselves with very high numbers that actually don't translate into disease burden. So academic interest for the number of cases, irrelevant. Now, this is also very important for the idea of a 3rd dose of vaccine. Now, Sajid Javid in the UK, our Secretary of Health, very keen on it. He's preparing to offer COVID booster jabs from next month, from early September. Now, the JCVI, the Vaccination and Immunity Committee, haven't yet reported on this yet, but Sajid Javid is getting ready for it. This is what he seems to want, over 50s to be set to offered boosters with the flu jab. So here we seem to be using this idea of ongoing boosters, whereas a lot of politicians are thinking, well, no, it's all around anywhere, so natural immunity is going to boost us. Now, we know that people who've had the infection followed by 2 vaccines have good levels of immunity. Data is being collected now, and I believe this data will show that 2 vaccines followed by natural infection will also massively boost the immunity. And de facto, that is what's going to happen, we believe, to most of us at the moment. Andrew Pollard again. I think as we look at the adult population going forward, if we continue to chase community testing and are worried about those results, we're going to end up in a situation where we are constantly boosting. In other words, I think what he's saying here, he doesn't want to medicalise the problem. Too much data, Too much information can be a bad thing. We're going to get a boosted dose of immunity every time we're exposed to this virus. Therefore, why do mass testing, as indeed the German situation? To try and deal with something which is simply not manageable, he is saying. We need to be moving to clinically based testing people that are sick. If someone is unwell, they should be tested. So the idea is that well people will not be tested. But for their contacts, if they're not unwell, then it makes sense for them to be in school and being educated. So again, driven very much by being unwell, not by positive or negative tests. And likewise, Dr. Richie Sooner, consultant paediatrician, she works at Imperial College London, choosing not to vaccinate children will be unlikely to cause problems in the health service. Quite a profound statement, because, you know, politicians have been wanting to vaccinate children. The idea about vaccinating children is being moved away from now because the virus is endemic anyway. Everyone's going to get it. So why vaccinate children? And the majority of children have probably been exposed already. It really is quite a big shift. So choosing not to vaccinate children wouldn't mess things up in the health service, she's saying. What matters is the burden of patient hospitalisation, and actually there hasn't been much with this Delta variant. Not because the Delta variant doesn't make people sick. We know that Delta variant is twice as likely to cause hospitalisation in people that are unvaccinated. So I kind of agree with her here, but I think she's probably overstating the case slightly, but there we go. This is what she says. They tend to be children who have got their comorbidities who are getting sick in terms of paediatrics. Particularly children with obesity and severe neurological disorders, although not always the case. We know there is an element of risk, but this is a British paediatrician talking in the British context, is what she is saying. Now, I think it is quite different in places like the Philippines and Indonesia, where there's been a lot of children getting sick and a lot of children dying because there's more malnutrition, more comorbidities. But here we have a paediatrician who doesn't seem particularly worried about healthy children in the UK. And those children are ready. So what she's saying is the children with comorbidities, obesity and severe neurological problems, they're already considered for vaccination anyway. And then she says this is a direct quote: COVID on its own in paediatrics is not the problem. So pretty strong statement, but it's coming from a paediatrician. So what we're seeing basically is a fairly major shift in thinking from a lot of the experts that we've been following throughout this pandemic. Now, it'll be interesting to see how SAGE goes along with this, but this does seem to be consistent with European thinking and some developing American thinking. What really concerns me is because the virus is going to infect everyone, and there's a lot of people not vaccinated, particularly in the United States, then people getting severely ill, people being hospitalised and people dying in the United States will carry on going up because the virus is going to be everywhere. So it's an interesting change, but for the unvaccinated, we really need to take this as a significant warning. So the major announcement is everyone's going to be exposed to this virus. That is now the consensus of expert opinion, and we should be prepared accordingly. So interesting shift, and it makes sense according to the way the science has been going over the past few weeks. So where we are. Talk to your friends who are unvaccinated. Explain to them that everyone's going to be exposed to this virus. Many experts now believe. Be ready for the time you are exposed to it. And as the sun's starting to go in now in autumn, I'm still fairly topped up on vitamin D because I've had a fair bit of sun exposure, but I'll be starting to top up my vitamin D pretty shortly now because the sun's going in and I won't be making vitamin D adequately. And also, don't forget, even though it is getting colder, we need to keep the windows open and keep things ventilated to reduce the viral load as much as we can. But we are in the situation where you personally, these experts believe you are going to be exposed to this virus. Okay, that is us for today, and thank you for watching.